I am here in Katihom, a part of Kerala in southern India, with Dr. Sreejit, and we are at Athreya, an Ayurvedic resort. Tell me, what is Ayurveda?
Yeah. It's a science of life as it is by its definition. Ayur is life and Veda is science. So basically it is a science that encompasses different phases of the human life, and that includes the medical side of it. Popularly known as a system of medicine, Ayurveda is basically more than a system of medicine, but primarily it is meant with a couple of objectives. The first being to protect the health of the already healthy people, and secondly to eradicate the ailments of those who have diseases.
So, Ayurveda is extremely old. It is 5,000 years.
Yeah, at least.
So, how has Ayurveda been passed down? How
Okay.
did you become an Ayurveda doctor?
Yeah, Ayurveda is definitely very old. It runs in the family in many of the families in Kerala and some parts of India. But even though we say 5,000 years old, it remains as long as the history of mankind. And there's always an updating happening to it. There's always more added to it. It's a continuous endeavor. And the way we become doctors now, it's more of an academic based training, apart from the traditional knowledge every family like ours carry. So we have a training in the family system that automatically makes it capable for us to handle medical issues, but there is a licensed kind of, if you can call it that way, a proper regime of professional regular training.
University.
Yeah, exactly, that's what we call as a college. That's the word we use, a college training of 5.5 years, basically 4.5 plus 1, and it is almost in the same syllabus method as the conventional medicines, 4.5 plus 1, 5.5 years of training.
So, how is Ayurveda different to Western medicine?
Yeah, there's a lot of commonality. The difference is Ayurveda emphasizes a lot on the food and the lifestyle aspects. It does not deny the existence of the microbes or the infectious nature of diseases. It's always there, but it has more importance given to an individual's innate immune system to be boosted the much most, so that a person is able to be away from disease and also cure himself with the support of therapies and medicines.
So,
So the holistic concept is what it makes
mind,
it.
body, spirit as well.
Exactly, very true.
And so, uh, what are the common easy things in Ayurveda to cure? What are the more harder things? Are there anything that you can't cure in Ayurveda?
Yeah, actually, most of the ailments that are found, easily 90% of the ailments that are mentioned in the textbook of medicine, of the conventional medicine, we use a text called the Davidson's textbook of medicine that's very commonly used in the western side of the medicine. But Ayurveda has its own treatise, as it's called, text of the science, which mentions a lot of diseases that are very relevant today. So more than the itinerary or the nature of the disease, it's the stage of the disease that decides the prognosis. So somebody with a certain disease at early stage is easy to cure, of course, and as it becomes more and more complicated, it becomes tougher to cure. So that applies to everywhere. Nevertheless, the diseases which are of more medical nature are much more easily cured. But having said that, even conditions like a gangrene, it's not exactly medical always. Diabetic foot, diabetic gangrene, cases of coronary heart disease, cases of renal transplant, kidney transplant. These are diseases which are, I won't say totally surgical, but not totally medical, but they could end up being a donor of kidney kind of situations, where Ayurveda has a role to play definitely. So I would summarize this question in the form of Ayurveda offers different levels of cure prospects depending upon the stage of the disease that somebody goes through.
So, as we look, we have a very distinct. You've got Western medicine
Yeah.
and you've got Eastern medicine. They're
Yeah.
two very different philosophies.
Yeah.
Western medicine tends to treat more the symptoms
Yeah.
than the cause.
Yeah.
So when you're treating patients in Ayurveda,
Yeah.
do you find recurrence?
Yeah, definitely. Because it's, with all respect to the Western medicine, it's such a great science, and so is Ayurveda equally great. The fact is, a simple example how we do not depend only on symptoms. If somebody has a running nose or a sneezing on getting up in the morning, the very common question we would ask, do you feel constipated? Because we do find those who have chronic constipation have this problem. It's also a simple question we make, do you have your shower after your dinner as a regular basis, or do you use oils on your head which are cool in potency? So long as the person is indulging in these things, he will keep on having sneezing and such running nose issues, allergic rhinitis, to one put an example, and that is not worth for antihistamines only. We need to be making very sure that this habit of him, that's a lifestyle, or this food habit where somebody has yogurt only at night time, is very prone to have allergic rhinitis. So unless he modifies this food and this lifestyle, he will never get rid of the antihistamines. He will keep on taking lifelong. So this is why Ayurveda says the symptomatic treatment of course is needed, but there's no denying tracing the root of the disease and eradicating it. But a patient of metastasis of cancer spread all over body, do whatever, you have to treat the symptom or the disease. The root cause nobody knows, and nobody can even modify it. So there are modifiable reasons and non-modifiable reasons. Somebody has made a fracture of the leg and the leg is stiff. The reason is of course a trauma or accident, whatever, not modifiable. But the stiffness can be improved, and the flexibility can be assured. So this is the difference how we look into, that's a philosophy of Ayurveda that makes it happen. But it's equally important to keep in one corner of the mind that when we say of the symptomatic treatment of the Western medicine, that we have a situation where we make what can be described as the detection, because some symptoms, when going through a level of detection, makes it much easy. So that's why we owe a lot to the Western medicine, because there are situations where you detect somebody's metastasis of the cancer at early stage. There are no Ayurvedic tools to detect it. So that's why it's so great, the system that we have now, the conventional method. And somebody has no symptoms at all, but the blood shows of hepatitis B carrier state. So we depend on that very easily. So this is how the difference comes.
So as medicine is evolving, and we have seen sort of the evolution of Ayurveda over 5,000 years, how do you think it's going to evolve in the next 30 to 50 years? You are part of a new generation of doctors versus sort of your father-in-law or his grandparents.
Yeah, definitely. What we find is now there is increasing help from the conventional medicine's biochemical findings or the scan methods and many other gadget-based findings. Basically they are derivatives of physics or biochemistry, which helps us to understand things a bit quicker and faster. So what is presently happening is, with the help of those tools, we are able to translate our science details to those levels and making it much more easier. And this is easily done in cases of eye disorders, where we are able to make things much better and make the cure faster, and detection earlier, and the prognosis better. And along with that, the level of researches that are now being happening in different forms of the pharmacy industry or of the Ayurvedic side, the herbal industry as it can be called, it encourages newer researches and newer products are coming out. So the generation we face, like our generation, which is like connecting the old and the new, we are now trained in such a fashion in our academy of the college that we know the oldest of the oldest traditional wisdom, and we are updated with the latest of the latest. With the latest British medical journal, we should read it, we should have it. So we are in no dearth of any kind of information. It helps the public a lot.
That's right. I've become a very big believer in Ayurvedic medicine. I arrived here at Athreya feeling very, very well, not sure if I was going to be needing any types of treatments, etc. Dr. Sreejit did an examination, and one of the things we discovered in my nose was a tuber constriction. In the conventional medical system, this would have involved a stay in the hospital, a fairly invasive bit of surgery, and probably thousands and thousands of dollars of hospital bills. But you did something very simple.
Yeah, actually, we make it appear very simple. It's all Ayurvedic. There's nothing special that we invented, nothing. It was always in the textbook of Ayurveda. It's just that we follow all the therapies very aggressively. Aggressive is equal to authentic, that's the word. Because usually, that's not the question you have asked me, but there is an equation, there's a kind of belief among the travelers or tourists that Ayurveda equals to massage, which is such a tragedy of understanding. And it's definitely not. Massage is a tip of the iceberg. It's not. It's just a very minute or a very minor part of it. So the reason is Ayurveda, at least I would say, because we are taught and trained in the latest of all the textbook of medicine, of the conventional medicine, we find easily 90% of the cases that is found in practice are manageable by Ayurveda in a very significant way. But that is to be discounted from the surgery, the traumatology department.
So here, instead of me going through surgery, just explain the quick process you did to address.
Yeah, actually the one that was made is a special paste application, we call the Kshaar Karma. That is basically the one that mitigates the size of the hypertrophy of the nasal. It is helpful even the nasal polyp, and there are many applications for it. So it's basically herbal paste that was applied in a selective way, as you saw, and then the mass shrinks, and there is a link, as we had shown you before, how somebody's was shrinking and shrinking the picture in the website.
Yeah. And so I went through a very quick procedure in Dr. Sreejit's office where he inserted this
So like applied
this paste, and immediately shrunk, and I felt a little bit of discomfort in the nose for about a minute or two, but I did not even have the watery eyes or the sneezing that sometimes comes with it. And within a few minutes I was breathing better, and I've even forgotten, within 2 hours I'd forgotten that I even had something semi-invasive in my nose. And so, Dr. Sreejit, tell me, what is the relevance of Ayurvedic medicine?
Yeah, the relevance becomes more important with increasing findings and increasing acceptability. However great the conventional medicine is really, really great, but it's not perhaps able to totally address to the health concerns of people, and that's precisely why we have people from 60 different countries coming here to address to the issues that are not satisfactorily managed. It's not the fault of the system at all, it's just that they don't have much to offer in chronic conditions of many nature, of many chronic illness, of various systems of the body. So this is why the lacunae that is existing in the management of the Western medicine's, I would say, prognosis, cure aspects in many common ailments makes Ayurveda more relevant. Increasingly enough people realize that the second point of the lack of side effects, absolutely zero. I won't say minimal, I would say zero side effects of the Ayurvedic medicines. They are herbal. Of course there are situations where metals and minerals are used, but it's very exceptional situations. But it's such a safe method that people feel very happy about it. Exceptionally there are situations where it doesn't help them, but it doesn't harm them at all. So they get the wellness part, if not the cure, but that's very rare. But everybody who has come here, they have a reasonable cure prospect addressed to them much in advance, and they feel it almost like a copy-paste effect.
That's right.
The side effects absence and the feeling the lacunae of the ones which are not best dealt with as of now.
Well, I want to say thank you for giving us an incredible experience here at Athreya Ayurvedic Center. I'm hoping that we will continue being able to revisit to do just wellness checkups. And instead of coming to deal with symptoms and ailments, it is about preventative medicine. In today's world, we have to start looking more and more to how do we keep ourselves healthy in a world that's becoming more and more toxic, a world where there are more and more stress and demands. So again, Dr. Sreejit, thank you for all you have learned, you got to share and create this amazing place, and I look forward to sharing it with our friends.
Thank you. Thank you.